Hello, everyone. 411 Business here today, and we have Dr. Drucker here to talk about a ton of medical advice for you. And to start off with, Dr. Drucker, tell us, are you going to start with the test? What are we learning today?
Well, yeah, we can start with the 30 systems test. See, what I do is I'm a little different than most, probably very different than most doctors' offices. See, if you think about it, let's say you have a problem, you have a concern. Okay, either you call your GP and you forget an appointment, you get in there, doctor sees you. He does one of two things. He either says, and he only spends a few minutes with you, but then he says, "Okay, well, here I'll write you a prescription for a drug. Now it's a dangerous drug and has side effects and toxicity. It can never heal you, right?" Or he says, "Well, you have to go to a specialist." So now you go to the specialist. Well, yeah, now you wait a while. You finally get into the specialist. The lady at the front desk, she's more interested in your insurance than in you, right? You
Mm-hmm.
finally get to see the specialist for a few minutes. Same old thing. They had a little history, maybe they take your blood pressure and whatnot. Next thing you know, you're getting a prescription, you're out the door. And this prescription can't heal you. It's a dangerous drug that has side effects and toxicity. It's not the cause of your problem. I'm the opposite. When you come to me, I take a thorough history consultation. I do a very thorough, unique exam. I find out what's really wrong with you. Now, so we get to the cause of the problem. When you correct the cause of the problem, you don't need the drugs to cover up symptoms, and it's all safe and natural. Now, don't get me wrong. If you have a medical emergency, go to the hospital. But short of a medical emergency, if you have a chronic problem, I'm the kind of doctor you want to see because I'll find out what's wrong. I'll actually diagnose you, and we'll fix it. And we'll fix it with safe and natural things. So it's an entirely different approach. Now, sometimes to help me, I run a test called the 30 Systems Test. And it's fantastic. You just hold a metal probe in your hand, and it checks you out for over 300 data points. Every vitamin, every mineral, toxic metals like lead, mercury, aluminum, cadmium, arsenic, nutritional minerals like the ones that we need, and we're not getting enough of because the soil is so depleted. Uh, every organ, even the immune system. It can tell whether you're osteoporotic. It can tell whether you have a fatty liver. It even gives you a pH determination. It's amazing. And by the time we're done, our test takes about an hour. By the time we're done, I'll know more about you than your mother knows about you. And it's very accurate, very reproducible. And then I prepare a practical summary for you about what the best things to do for you to improve your health, either prevent disease or to get rid of the problems you have. So, for example, there might be a lifestyle change. I go into whatever kind of exercise is best for you, for example, or you may need certain nutrients. Well, we all need nutrients because the food doesn't have it today. Or what about detoxification? We're exposed to over 100,000 toxins that didn't even exist 100 years ago. Can you imagine? Even the cord blood coming from a pregnant woman to her newborn baby they stopped testing after 860 toxins they found in there. Okay, so we got a detox, and I can show you safe and inexpensive and very practical ways to do that. Then there may be some other things you need, whatever it is. The point is, between the detoxification and getting all the vitamins and minerals you need, which you're not getting, and maybe customizing a diet for you. Now, some people need to lose weight. We can do that, get them on a weight loss program, but it's a healthy weight loss program. There's no drugs or anything like that. And once you develop new habits, you're going to keep the weight off. But what about people with diabetes or an autoimmune disease? The medical people they don't have anything effective for that. So I really get to the cause of the problem. So that's what the 30 system test helps me tremendously. A thorough consultation, history, and exam. My exam is neurologic, orthopedic, musculoskeletal. I even check your organs. There's something called applied kinesiology where we can check your organs. It's fantastic. It's totally safe, painless, very practical. I'm very practical. I basically I just want to help you. I don't want to waste your time. I don't want. And I want to get to the cause of the problem so we can solve it. So that's the 30 systems test. Now I also do a procedure called cranial release. Well, most people know we've got these 22 cranial bones, and they're joined together by these little kind of joints called sutures. You've seen them. They're kind of like these squiggly little joints, right? Well, you might say to yourself, well, why do we have those squiggly little joints in our skull? Nature put it there for a reason, or God put it there for a reason. Well, there is a reason. It's because those little squiggly little joints, every time you breathe in, they have to expand a little bit. Every time you breathe out, they have to contract a little bit because they're pumping the cerebrospinal fluid, which doesn't have a heart and it has to move. It carries waste products and oxygen and carbon dioxide and nutrients. It has to move. It can't be stagnant, or you're going to get sick, or you're not going to function as well. So anyway, so we facilitate that. It's called the craniosacral respiratory cycle. You can look it up. And then people have a lot of tension. They have pain. They may have headaches. They have stiff necks. They may just have some chronic problem. And there's an area in the back of your skull called the occiput. That's that big bone back here. And right below that, there's a ridge called the suboccipital ridge. And that area is very sensitive. In fact, if you press on it, both the right and left side, you'll see there's probably a sore spot or two in there. And we work on that. And by the time the person's through with the visit, it may have gone from an 8 or a 9 pain level to a 1 or a 2. Sometimes it's completely gone just in one visit. But that relaxes them. It has all kinds of benefits. See, the skull can go through a deformation process. If you have a traumatic birth, like they use those forceps, to pull the baby out, or they use that suction thing to pull the baby out, that can deform your skull. And that interferes with that craniosacral respiratory cycle. It can also deform your face and head. Some people, they actually look better. They actually look more relaxed. They have a more symmetrical face after it. So this is very unique. It's totally safe. And these are the kind of things that we do. We also have other things. We have pulsed electromagnetic field therapy, which is fantastic. It actually improves the electrical potential between the outside and inside of the cell. Again, it's totally safe. You don't even feel it, but you get stronger. I can test you while you're on the mat, and you're much stronger when I turn it on than when I turn it off. It's because your body's working better. It's more efficient. Nutrients in, waste products out. We also have red light therapy. It increases nitric oxide circulation, speeds up wound healing. So does the PEMF blanket. We have all kinds of, they're all safe. They're all natural. They're all scientifically based. And I don't think most doctors are doing this.
So, Dr. Drucker, with your red light therapy, let's go into that just a little bit more. What exactly, if I'm your patient and I come in for the red light therapy, what is happening in your body?
Yeah, that's a great question. Well, it turns out there's a whole field of study called photobiomodulation. Photobiomodulation. And it has to do with the different effects on the human body of different wavelengths. For example, blue light is entirely different than, say, red light. Now, red light is generally far more therapeutic because what it does is it relaxes the tissues, it increases circulation, and something called nitric oxide, very important, which helps circulation, helps your immune system. And the blood really is what heals us. So when you get more circulation to various parts of your body, they heal faster. Pain even is diminished typically, and your circulation improves. So, but each wavelength of light. So typically we use a 660 nanometer. That's a red light, but we also use infrared. See, infrared produces heat, but you don't see it. It's invisible to the naked eye. But the combination of the red light and the infrared is tremendous. I mean, you get tremendous increase in circulation, more rapid wound healing or healing of other problems. It's extremely relaxing. You don't even. There's no pain or anything whatsoever. It's completely safe and natural. But there's a whole field. You can look it up. Biophotomodulation. How different wavelengths of light and what they and energy affect the human body. And this is going to explode into the future, although very few offices really have this now, although more and more are getting this red light therapy.
That's amazing. That literally is so amazing. So now when you talk about the intracranial, the intracranial release?
Well, it's called cranial release technique. And see, like I say, you've got those 22 bones. Now, you may have had a traumatic birth. Maybe they use a forceps. Maybe they use that extractor. Maybe you had a C-section. You know, a C-section does not produce a normal birth because, see, normally when the baby comes out through the birth canal, there's some pressure and it literally molds the head into a normal position. You know, nature's not stupid; it knows what it's doing. But when you just when you just cut unfortunately, when you cut the woman's abdomen open and you pull the baby out, there's none of that molding process. You see, so it's really a C-section births are not good. Now I understand there's medical emergencies. Sometimes I have to do it, unfortunately, but but that's got a lot to do with a lot of things. Like, for example, I mean, most women they don't do prenatal exercises and go to these natural birthing classes and all that. Well, you know, like my my ex-wife, when we had our baby, we used to go to yoga classes prior to her giving birth. We went to these natural birthing classes. My baby was born under the water in a tub with just candlelight. No fluorescent lights. Nobody whacked her on the butt. No silver nitrate burning her eyes. I mean, she's so cool and calm and collected, so sweet, my daughter, because she was never traumatized. Imagine how traumatic it is. You're in that warm, moist environment. All of a sudden, you come out to the world, boom, you see these bright fluorescent lights, which are blinding you. Then somebody holds you by your ankles and whacks you on the butt. Then they put the silver nitrite, which burns your eyes. I mean, give me a break. That's hello to the world? This is not good. So we've been traumatized. I mean, just the birth process and that mistreatment. And not only that, they have the woman lie face up in bed. Now the baby has to go up through the birth canal, fighting gravity. No wonder the woman's screaming and in so much pain. It's so difficult for her. She should be squatting or in the tub and relaxed in a nice warm tub, and then the baby just slips right out. When I asked my wife, I said to her, "Well, honey, you just had a baby. I was there for the process. I mean, I saw the baby being born under the water. I said, you didn't cry or scream." She said, "Well, I didn't have any pain." Now, in the movies, oh, the woman's screaming, she's crying, she's freaked out, right? She wants drugs. No, if you do it, if you prepare for it, it's not that way. There's very little or no pain. The baby comes out, the baby's happy, and then they take the baby. Even before they cut the umbilical cord, they put the baby on the mother's chest. The baby's very comfortable, feels secure. The mother loves it. It's great. But compare that to a hospital birth. Oh my God. It's like it's just nuts. Anyway, I don't want to get too far afield for that, but that's one of the reasons people have misshapen skulls, because they don't go through the birth process. Or that could be traumatic. They can have an accident or an injury, and that can affect your cranium. And let me tell you, it's important. You have 12 cranial nerves that are coming out of your skull. They don't come out of your spine. They come out of your head. Vision, taste.
Yeah, let's talk about that. Talk about.
So some people, if they could have a vision problem, they could have a smell or taste problem. They could have chronic pain. They could have a temporomandibular joint problem where they're grinding their teeth. And even that bite plate isn't really helping them that much. And I can realign your jaw with a proper procedure. And it's totally safe, painless. And everything starts working better. Chronic headaches go away, stiff necks go away. These people that are grinding their teeth, you can stop them from grinding their teeth. I had a patient come in once. He was one of these high-pressure businessmen, and he would grind his teeth at night because they had a TMJ problem. He ground down his teeth so badly, he had to get caps on all of his teeth.
Oh, wow.
That was thousands and thousands and thousands of dollars, not to mention the fact that he ground his teeth. It's crazy. Well, I worked with him. About 3 or 4 treatments, no more grinding, no more teeth grinding. You see, even though he had caps, he was still grinding his teeth, right?
Wow.
They didn't really fix anything. So, which is typical. I mean, it's just, I don't care if you have a foot problem. I don't care if you have a head problem. I'll check it from top of your head to the bottom of your feet. I'll give you an example. There was a gal, very healthy gal, beautiful gal, and she wanted to go back to Brazil to see her parents. She hadn't been there in quite some time. Well, she had to get a couple of shots. She didn't really have to, but she kind of caved in and, facilitate visiting her folks in Brazil quicker. Well, she had a bad reaction. So in Brazil, they have a lot of these, like herbalists and naturopaths. And there's a lot of folk medicine and natural medicine in Brazil. So she went to one of these doctors who was very advanced. He was using all kinds of great stuff. And she improved, but she was still sick. So when she came back to the US, and I'd seen her before, I mean, she had this gray complexion. I said to her, "Where's your pain?" She said, "From the top of my head to the bottom of my feet." She had fibromyalgia, among other things, fatigue. She was kind of depressed. Anyway, gave her a great treatment, did the cranial work, did a great treatment, did some physical therapy, put her on the red light and the QRS and the pulsed electromagnetic field therapy. She was in the office about 2 hours, but she needed it. So at the end of the 2 hours, she gets off the table. I say, "How you doing?" She says, "Oh, all my pain is gone. And I feel better." She had rosy cheeks again, She had a big smile on her face. So I said, "Okay, give me a call later this afternoon. Tell me how you do." So about 2 hours later, she calls me. She says, "I had the most voluminous menstrual discharge of my life." She was getting rid of all those toxins, right?
Mm-hmm.
She filled up her cowboy boots, had to change her dress, go home and take a shower. But she felt great. One visit. Now, okay, it was 2 hours and we did a lot. But, and then she followed up and she took some ivermectin and some methylene blue and she did some other things. But she has no symptoms at all anymore.
Now, when you said she followed up and took some ivermectin, are these items that you told her about?
Well, we have an osteopathic doctor. He had to write a prescription. See, I have a holistic practice. We have an osteopathic doctor. In my office, we have a doctor of Oriental medicine who's fantastic. He uses homeopathy. He does acupuncture. He does herbs. And then we have detoxification. We even have hyperbaric oxygen. We even have a lady that does colon therapy. I had a patient come in, great guy. He was a retired fireman. Great guy, great shape. Those guys are in good shape. Anyway, make a long story short, he had chronic insomnia. He couldn't sleep. And if you can't sleep, it's like torture.
Mm-hmm.
And it was going on for months. So he finally came to me. Okay, I'm doing some things. I'm helping in the cranial release and whatever, the chiropractic work and whatever else I could do, some nutrition. And he was getting better, but he wasn't 100% better. So we referred him to the colon therapist. He had, I think, 2 or 3 high colonics. Do you know he was completely 100% better after what we did for him?
I believe it.
And there were no drugs that were working. He didn't want to take drugs anyway, but he was on sleeping pills, which would give him maybe 4 hours sleep a night. And he still was miserable. Now he's on no drugs and he feels great. And his insomnia is completely gone. So these are the kind of things we can do with holistic health. See, holistic health is different. You don't just take a drug or maybe go on a diet or something. It's everything. We take everything into consideration. That's why we do a thorough history. My history alone can take 20, 30 minutes because I got to find out. Now, some people it's quick because it's not complicated. But other people are complicated. It takes time. And you know what? You know that 90% of your diagnosis is in a thorough, proper history?
Mm-hmm.
And how many doctors sit down with you? Okay, how you doing? What's your diet like? You're getting enough sleep? How much water you're drinking? Whatever, all these things. They don't do that. They say, "Here's your symptoms. Take this drug, and that's it. Goodbye, Charlie." I mean, or they might say something like, "Well, you have to eat a healthy diet and get more exercise." What does that mean? What does that mean? It doesn't mean anything. But what they'll also say to you is, a lot of some they'll say, "Don't take vitamins or minerals. You'll just have expensive urine," as if a few dollars worth of vitamins a day is expensive compared to getting some god-awful disease where they're going to take $250,000 and you're going to die and torture you to death, right? I mean, you tell me what's expensive, okay? Or they say crazy things like, they say, "Well, we don't know what's wrong. It must be all in your head," because they can't figure it out, right? Give me a break. Okay, what are you, mentally ill because you can't figure it out? I mean, that's absurd. How about this one? "Oh, you'll be dead in 6 months. Get your affairs in order." Who are they to say things like that to people? It's so negative. And if you do the right things, it's almost always wrong anyway. I've had people that were told that they'd be dead in 6 months. They were alive 12 years later. And guess what? The original condition is completely gone. Because we used nature and we helped the immune system. The immune system is the best doctor in the world. You cut your hand. If you didn't have a properly functioning immune system, you'd be dead of an infection in 3 days. Okay? How about every bacteria, every virus, every fungi, every parasite, every abnormal condition? Your immune system has to take care of you. It's been around for millions of years. Do you know the last system in your body to give up is your immune system? Even when you die, your immune system is still working for a period of time, trying to protect you. That's how persistent it is. But today, it's under attack. We have artificial food with hardly any nutrients, no minerals worth talking about, and lots of other of nutrients are gone. And then you've got all those poison sprays on top of it, like glyphosate and organophosphate fertilizers and all that stuff, which are poisoning us. And then you got water. I mean, they put chlorine and fluorine, two terribly toxic poisons, in your water. It's totally unrequired. Now, in Europe, I understand they use ozone. Well, ozone's great because ozone takes a toxin or a bacteria, kills it, and it turns it into water and carbon dioxide, which is completely safe. But
So
when you take,
Dr. Tucker, you're talking about water. What are you telling people to do? Come in.
What I'm telling you is, you got to figure this out. If you want to avoid all these nasty diseases, if you want to live a long and healthy life, you have to be aware. You can't be eating McDonald's and drinking Coca-Cola or worse, Diet Pepsi or whatever. I'm sorry, I don't want to mention the names really, but Diet Colas or whatever. You got to read labels. Go to a holistic doctor that's going to really check you out, find out what toxins do you have. You need a detox. What nutrients are you missing? Do you have something out of place in your spine? Is your nervous system working properly? You see, chiropractic is really applied neurology. Okay, we don't do brain surgery, God forbid, right? But what about like your cranium? Those 22 bones, don't you think they have to be lined up so that the cranial nerves are working properly? How about the spine? You have a pinched nerve. You could have high blood pressure because you got a pinched nerve in your back. You could be constipated or have diarrhea because you got a pinched nerve in your low back. Okay, so and that's what a chiropractor figures out. The good ones, the ones that are really, really trying to help you. And I've only been doing it for 45 years. I actually teach chiropractic. I'm a professor of chiropractic. I also teach doctors how to diagnose. I have a course called Laboratory Differential Diagnosis. I was doing cancer research when I was 19. That was 55 years ago. Nothing can compete with experience. And I love my work. A lot of people say, "Oh, why aren't you retired? You're 74 years old." Because I love my work. I also have a daughter in college, and I have those expenses. I still have to make a living. But the point is, I love it. How many people go to work, they're not happy? I love it. Can you imagine? Someone comes in, they say to me, I've had this problem for 20 years. I've been to all these different doctors. I've tried everything. I've been to the MD. I've been to the acupuncturist. I've been to the nutritionist and natural, whatever. I tried this diet. Nothing worked. And in 3 or 4 visits, are completely better. Or maybe it takes a little more time, but I need to see them a lot because once I do my 30 systems test and I figure out what they need, we give it to them. Okay, they may come back a few times for a checkup. And they get completely better. In fact, if you go to my website, healtherootcause.com, you'll see dozens and dozens of video testimonials from people who got better from supposedly incurable diseases that were not. Without drugs, with nothing dangerous. Now, don't get me wrong. If you have to stay on your drug a while, fine. I don't tell you to take or not take a drug, but you can use my program as a crutch to get off your drugs in most cases. I mean, diabetes is usually typically gone in 6 months.
Wow,
even autoimmune diseases. Look at my website, healtherootcause.com, or look at dynamicmedicine.solutions. You'll see all kinds of video testimonials from patients that got better for all these crazy things. All natural, all safe, very practical.
Dr. Drucker, have you worked directly with any AIDS patients?
Yes, about 38 years ago, you reminded me, 38 years ago, when they didn't have those cocktails, but they can keep them alive with the cocktails now, right? Before that, a fellow comes in, he came in a wheelchair, and he had terrible sciatica. Well, I got him out of the wheelchair in 3 visits, and the sciatica went away. But I looked at his chart, and he not only was he HIV positive, but he had full blown AIDS. He had Kaposi sarcoma, that's the skin cancer that they have. He had chronic diarrhea. He was skinny as a rail. He was depressed. He was dying. His killer T cell count was ruined. His immune system was in big trouble. So I said to him, "Would you like me to do something for your immune system?" Because I've been very interested in the immune system for many, many, many years. He said, "Sure," because he felt so good. He figured probably I could help him with this too, right? Well, he started taking these immune modulators. They're called Digesticure. Today, that really the best one is Ace Mannin. Ace Mannin. In fact, you can call them up. Their number is 888-671-2873, 888-671-2873. If you have any immune system problems or digestive problems, just call them up. Now, you can also call me at 954-547-0487, 954-547-0487, and I can counsel you on how to use it. Because it's not, people vary. People are individuals. They may have to modify the program a little bit. But anyway, I gave him that. I gave him some advice. I did some chiropractic with him. And I gave him a couple of vitamins and minerals and things. Do you know, in 2 weeks, his killer T cell count increased by 1/3. His Kaposi sarcoma went away. It's not unheard of. He gained weight. His depression, he felt so good and had so much energy, his depression went away. His medical doctor was given a human growth hormone to try to combat some of the ill effects of the HIV/AIDS. Wasn't really working. He would take the human growth hormone. He would go to the gym and sell it to the bodybuilders because he was on disability. He didn't have any income except a little disability, right? But he would make all this money selling the growth hormone to the bodybuilders because they can really bulk up like crazy. And it's very expensive, And he'd come in with these wads of cash. He'd pay me for the visit. He paid me for at that point, I was actually providing the immune. I don't do it anymore because of various reasons. I don't want a conflict of interest. But that was like 38 years ago. Anyway, that's completely stopped. But you can get it with the company, like I said. And he got better and better and better. Well, after 5.5 months, he was doing so good, he didn't come back anymore. He felt fine. Now, you can't force a patient to come in. If they feel better, they say, "Well, what do I need you for anymore?" Right? Then they just disappear, right? So anyway, I moved my office.
Was they going to just come by to say hi?
Well, no, I'm going to tell you. So what happened was 5 years later, I moved my office, and 5 years later, this guy walks in. I didn't recognize him. He said, "Oh, thank God you saved my life. God sent me to you." He was that guy. He's supposed to be dead. They didn't have the cocktails back then. He's supposed to be dead. I mean, I almost fell on the floor. So guess what? He has a gal with him, and he says, I want to introduce her to my fiance. We're getting married next month." Oh, wow. I almost fell on the floor. That's why I had to write the book. I saw these amazing cures. I mean, you're not supposed to use the word cure. I don't cure anything. Your immune system cures you. Your immune system heals you. It's been that way for millions of years. I don't care if you cut your hand. I don't care if it's a bacteria, virus, fungi, parasite. I don't care what it is, abnormal tissues. Your immune system is there to heal you, and normally it will. But unfortunately, like I say, today, we have so much pollution, so many toxins. We have such poor food that is so nutrient deficient. And we have stresses that maybe didn't exist, say, 100 years ago, too. And we've got a nasty environment. We have all kinds of things. You have to be an educated healthcare consumer today to be healthy. And that's why I talk about all these different things, because they're related. Now, some people are more toxic than others. Some people are more nutrient deficient than others. Some people are too acid. Some people are this and that. There are variations, obviously, and we're going to treat you as an individual. But there's also certain things that apply to almost everybody. Everybody is toxic to some degree. I mean, everybody has some spinal misalignment and a pinched nerve, whether you feel it or not. Not that you may need a lot of treatments, but you probably need a good checkup. And we'll give you a treatment or two just to get you straightened out. I mean, just imagine. Let's say you decided you wanted to go on a nice trip one day. You wanted to take a nice hike one day, right? So you put on your socks and you put on your hiking boots and you get ready and you're ready to go. So now you go out there and a pebble gets stuck in the back of your heel on one shoe, right? Back of your heel. And it's annoying and you say, what the hell? I mean, I'm going to keep up with everybody. I don't want to stop and take the pebble out. What are you going to be like in an hour or two? How about by the end of the day? You're going to be a mess. that painful heel is going to be really driving you crazy. Not only that's going to affect the way you walk, right? You're not going to enjoy your trip or your hike. You see, that one little thing. So sometimes you have to find, you always have to find the cause of the problem. Okay. That's an obvious thing. But how many people have come to say, I've been to all these different doctors, nobody could figure it out. And I start doing my tests. I take my history, I do exam, I poke here, I poke there, I do orthopedic tests, neurologic tests. People say, nobody ever did that before. How come nobody else checked me out like the way? Nobody else told me. And I find all kinds of diagnoses that the other doctors have missed. And then they say, well, how come nobody else told me that? Why didn't anybody else do these tests? Blah, 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 right? And I say, look, I don't know. I don't know why, because I'm thorough. Because I've got 50 years experience in healthcare, maybe. Because I'm like, look, I want to find the cause of your problem and I want to help you fix it. Okay. Okay, that's it. I don't want to cover things up with drugs or artificial stuff. I love doing things in a natural, safe way, practical way. It gives me a kick. I mean, I've had parents come in and say, "Thank God, God sent me. You saved my child's life." What is that worth? You tell me what that's worth. So what if I spend a little extra time or some free phone calls? I don't care. Hey, I lost you. I can't hear you. I can't hear you. I lost your audio.
Okay, there you go.
Oh, that's better. Thank you.
All right. Well, there we have it. 411 Business today. Dr. Drucker and his amazing 30 system test. So, for everyone who's listening that wants to hear from you, contact you, how do they reach you?
Well, the best thing is either to text or call me at 954-547-0487. That's 954-547-0487. That's the best. Now, you can also look at my websites, healtherootcause.com or dynamicmedicine.solutions or holisticlives.org, holisticlives.org. You can read my book, The Code of Life. I have a new book that's just coming out within the next 2 weeks. It's called How to Heal the Immune System. Now, today, don't you think that's important with all these viral diseases and these bioweapons and all this crazy stuff that's happening? Everything from MERS and SARS, and we had HIV, which was an immune problem, and now we got all these flus and God knows what. You got to take care of your immune system. This is what I've been studying for 45 plus years. And all you have to do is give me a phone call, 954-547-0487. You don't necessarily have to come into my office. What if you live in Timbuktu and I'm in South Florida? I'll still give you some friendly advice. I'm not your doctor, but I can point you in the right direction. And I'm happy to do so.
All right. So everyone hit that like button and subscribe to 411. Dr. Drucker is a part of our network. And you can also get in touch with Dr. Drucker at 411business.com.net or .org. Thank you, Dr. Drucker.
Okay. Thank you, Joan.